In this lecture, we're going to look at the kidneys and the suprarenal glands. So we'll start off by looking at the position of the kidneys and the suprarenal glands and how that position is mirrored onto the surface of the abdomen. We'll then explore their gross anatomy by looking at the position within the abdomen and their relations to other organs. We'll look at the kidney segments and their specific blood supply. We'll then look at the internal structure of the kidney and the suprarenal glands, look how the renal pelvis is formed, and that gives rise to the ureters, and we'll look at a few constrictions that they have along their course. We'll then look at the suprarenal glands vasculature, because that can be quite complex. So the kidneys are paired retroperitoneal organs located against the posterior abdominal wall, and they're really important in removing excess water, salts, and waste products from the body. They're important in that they maintain the correct balance of nutrients and chemicals, so maintaining homeostasis, the internal environment. The suprarenal glands also play an important role, and that's in supporting the blood pressure and releasing adrenaline, and we'll explore that through this lecture. So let's have a look at the surface anatomy of the kidneys and the suprarenal glands. Well, here, the best way to view the kidneys is posteriorly, as they are located against the posterior abdominal wall, either side of the lumbar vertebrae, really extending from T12 and L3, extending down from about T12 to L3. And we can see they're sitting against ribs 11 and 12. So if someone was to damage the ribs, they could then puncture the kidneys. So we can see where the two kidneys are positioned. This anterior view with the other organs in place is practically impossible to see the kidneys. But again, if we look at the posterior view, we can see both of the kidneys here, again associated with ribs 11 and 12, and sitting against vertebra 12, T12, L1, L2, and parts of L3. The right kidney is somewhat lower than the left because of the liver, the presence of the liver just pushing the right kidney down a touch. So some key facts about these organs. The kidneys, as I've mentioned, they're a paired retroperitoneal organ located between the transverse processes of T12 and L3. It's important in removing excess water, salts and waste products and maintaining the correct level of nutrients and chemicals in the blood, maintaining this acid-base balance and maintaining blood pressure by regulating the amount of water we have within our body. They pass urine to the bladder via the ureters, and then within the bladder it's stored prior to micturition. Each of the kidneys is surrounded by a tough renal capsule and considerable fat, perinephric and paranephric fat, which we'll see. And each of the kidneys is divided into 5 segments, with each of these segments supplied by a segmental renal artery. The suprarenal glands, which we'll explore towards the end of the lecture, these are located on the supramedial aspect of each kidney. So if we return the supramedial aspect, we can see the suprarenal glands are going to be located around about here on both of those kidneys, and these are intimately associated with the superior poles of the kidney. They have 2 parts, an outer cortex and an inner medulla, and as we'll see, these are highly vascular glands. So this is an in situ cartoon of the kidneys. We can remind ourselves of what we're looking at. We've got the aorta running down the midline here. To the right of the aorta, we've got the inferior vena cava. And we can see we've got some parts of the quadratus lumborum muscle. We've got psoas muscle here. We can also see a psoas muscle here. We can see the part of the diaphragm around here. We can see where the esophagus has been cut as it passes towards the stomach. And we can see that the kidneys have this substantial amount of fat surrounding them. On the supramedial aspect of each kidneys, we can see we have the adrenal glands. So that's a general overview. They're located between about T12 and L3. So this will be T12 and this will be L3. That's their approximate position, sitting in what's known as the paravertebral gutter. Just some depressions either side of the vertebral column. Posteriorly, as I alluded to in the previous slide, there's a series of relations. There's some nerves, some muscles, subcostal nerve, which we can see, iliohypogastric, ilioinguinal. And these are passing down here, subcostal, ilioinguinal, iliohypogastric. We can see those posteriorly to the kidney. We can see it sitting on some muscles, the diaphragm, quadratus lumborum. It's also just sitting lateral to psoas muscle, which we can see here. Suprarenal glands sit on the supramedial border, and there's an intensive arterial supply from the aorta. Substantial renal arteries pass across to the kidneys, and the suprarenal glands also have considerable arterial input, as we'll see. Both of these organs, the suprarenal glands and the kidneys, are supplied by considerable fat, and this helps to hold the kidneys in position. The parietal peritoneum anchors them to the posterior body wall. They don't have a mesentery to suspend them. So they're surrounded by fat, which provides warmth, provides some protection, and it anchors them to the posterior abdominal wall. So here we can see the kidneys in section, where if we return to the previous slide, if we've taken a section through the posterior abdominal wall, approximately where that line is, then we can look down onto the kidneys and we can see this is the posterior aspect here, this is the anterior aspect. We've got the liver, and here we've got the anterolateral abdominal wall. We can see the kidneys are here on the left and right in this paracolic gutter, which we can see. We can see the lumbar vertebral bodies here, and we can see the transverse processes. We can see each of the kidneys sitting on this muscle bed. But what we can see also is that the kidneys are surrounded by a substantial amount of fat, which is surrounding the kidneys here. And this is the paranephric and the perinephric fat, which is positioned around each of the kidneys. So each kidney is surrounded by this perinephric fat, like a perimeter fence around. And this is continuous at the renal sinus, which is this space here. We can see this space, this kind of hollow space within the kidney, and that's the renal sinus. And the fat of the renal sinus is continuous with this perinephric fat that surrounds it. The renal fascia surrounds the perinephric fat, and we can see we've got a tough kind of membrane around here, which is surrounding the kidney. And then lateral, superficial to the renal fascia, we have paranephric fat. And this is found superficial to this fascia, and it's positioned more posteriorly. This capsule helps to support, with its fat that's surrounding it, support and maintain the position of the kidneys. So let's have a look at the kidneys in this view, which shows the various relationships the kidneys have with the other organs and also their blood supply. So first of all, we're looking at the kidneys, looking at the anterior surface of the kidney, and we can see with this convenient key that we have at the bottom here, in red, we can see this right kidney. This is the right side, and this is the left side. That most of this kidney here is associated with the liver. And remember, the space in between the liver and the kidney on the right side is the hepatorenal recess. And that recess is continuous with the pelvis via that right paracolic gutter. We can see at the supramedial aspect of each of the kidneys, we have the suprarenal glands. So we've looked at the suprarenal glands and we've looked at the liver. Here we can see the hepatic flexure, or the right flexure of the colon is sitting against the kidney. We can see it here. And we can see it has relations with the jejunum that are sitting alongside this more inferior pole of the kidney. We can see that towards this hilum, we have the duodenum, sitting against the kidney in this aspect near the renal hilum. And then we can see on this side, on the left, we have the stomach, we have the spleen, and we have the pancreas, and we have the descending part of the colon. So these shadings indicate the relationship the kidneys have sitting on the posterior abdominal wall, the anterior relations they have with those organs. And you can see they're coming into contact with a lot of the organs within the abdomen. If we look at the blood supply, then we can see this really clearly in this diagram. If we look to the right-hand side, we can see we've got the inferior vena cava, and running down the midline, we've got the abdominal aorta. We can see those unpaired rissal branches, celiac trunk, superior mesenteric artery, and down here, the inferior mesenteric artery. And what's shielding the renal arteries are the renal veins. Here we've got the inferior vena cava, and we can see that the kidney is giving rise to this left renal vein here. Coming away from the kidney, we've got this left renal vein. Coming from the right kidney, we have the right renal vein, and these will then drain up towards the heart in the inferior vena cava. We can see draining into the left renal vein here, we've got the left gonadal vein, testicular or ovarian, and that's draining into the left renal vein. These are shielding the arteries that lie behind them. Because the left renal vein runs anterior to the aorta, it's longer and it courses across. Here we can see the aorta. It's running in front of the left renal artery, which we can see here. The left renal artery can, in fact, course anterior to it, right at the hilum of the kidney, which we can see here. So we can see this nice blood supply, and these blood vessels come off at around about L1, L2-ish region, where the renal arteries and the renal veins pass to and from the kidney. So this is a really nice diagram showing the blood supply and the relations of the kidneys. Here we can just see the notes that I've added to go alongside this. We can see the renal arteries and the renal veins. We can see that the renal artery has a longer one on the right. That's because of the position of the aorta relative to the inferior vena cava, and the right renal artery passes posterior to it. And then we can see that the renal veins are draining into the inferior vena cava, and we have a longer left renal vein as it's passing anterior to the aorta. So a nice diagram indicating the blood supply and the relations of the kidneys. If we look at the segments of the kidneys, then this isn't indicating the relationship they have with other organs. This is actually just indicating the various segments. And each kidney is divided into 5 segments. So we have one here in blue, then we have 2, 3, 4, and 5. We can't see these both on each side, but anteriorly we can see we've got one here, and then anterior, superior, and anterior, inferior segments here. We can't see those on this one because this is more of a posterior view, and this posterior view lets us see the posterior segment, which is here. But both the superior and inferior segments are viewable on both this anterior and posterior view, anterior here, and we can see an inferior segment here and here. So these 5 segments are important because each segment of the kidney is supplied by a specific segmental artery. And these are segmental end arteries, which means they don't have any anastomoses. Like the anastomoses we saw between the left gastric, right gastric, left gastromental, right gastromental, we don't have that here for the kidneys. We have these end arteries. So one branch of the renal artery will go and supply a specific segment, one of these 5 segments. So let's carry on looking at the kidney, and let's just have a brief little look at some external features. I appreciate this kidney has been sectioned so we can see into the hilum, but let's have a look at some of these external features. We can see we have a superior pole up here, and we have an inferior pole down here. We have a nice convex lateral surface around here, and we have an indented kind of concave medial surface, and this is the renal hilum. This space here is the renal hilum. The renal hilum marks the entrance to a space that I've indicated earlier, located within the kidney, and that is the renal sinus. So this space here is the renal sinus. We can see it's filled with fat, also running within the renal sinus. Through the renal hilum are the renal veins, the renal arteries, and the renal pelvis. We'll see the formation of the renal pelvis, which is continuous inferiorly with the ureter. We'll see that the renal pelvis is formed via major and minor calyces, and these drain the renal pyramids. We'll speak about these later on. Also passing through the renal hilum within the renal sinus are going to be various nerves that control the activity of the kidneys. So make sure we're happy with the superior pole, inferior pole, a nice curved lateral convex surface and an indented medial surface, which is the renal hilum. Each of these minor calyces are going to be formed via a renal pyramid, and we can see these renal pyramids indicated here. And renal pyramids are where the nephrons are located that do this water exchange, that control the water content, that control the salt content and produce urine within the kidney. And they pass this fluid passes through what's known as the renal papilla, and it opens up into a minor calyx. So each of these renal pyramids, which we can see here, separated by a renal column, the renal column being an extension of the cortex in between the pyramids, these will give rise to a minor calyx. Now, the minor calyces are going to form a major calyx. So here we have a number of minor calyces forming a major calyx. And you may have 2 or 3 minor calyces merging to form a major calyx. And then 2 or 3 major calyces forming the renal pelvis. So here we can have a minor, forming this major one here. We have a few more minor ones, say here and here, and they're going on to form another major one here, and a few more majors receiving the minor calyces here. And ultimately, these are all coming in to form the renal pelvis, this dilated kind of triangular shaped part within the renal hilum, passes through the renal hilum, and it's then continuous with the ureter. We can see in this case that we have maybe a couple of renal pelvis, they kind of split, and we can also see we can have a kind of large renal pelvis here where it hasn't split and it's receiving those minor and major calyces. Once the kidneys produce the urine, it then passes down the ureters into the bladder. And we can see in this section, this sagittal section through the male and the female trunk, we can see how the ureters pass down towards the bladder. Now, we'll consider the bladder when we do the reproductive organs in the pelvis. I appreciate the bladder isn't a reproductive organ, but it's in that location, and it makes more sense for us to deal with it there. But for now, we can see that the ureters in both the male and the female are passing down towards the bladder. This is just the right kidney being indicated, but we can see also that we have a left kidney giving rise to a ureter as well. And these pass down, these muscular ducts, they pass down to the bladder where the urine is then stored. They're retroperitoneal throughout their course. Along their course, each of the ureters can become constricted, can become narrowed. And this is important if you were to have a kidney stone, which could then become lodged against these constrictions, preventing urine from passing down towards the bladder. And this can happen in one of 3 places. It can happen where the ureter joins the renal pelvis, so it can happen quite high up in the renal hilum, where the renal pelvis narrows down into the ureter. It can be where it crosses over into the pelvic brim. So this is where it's crossing over usually the bifurcation of the common iliac into internal and external portions. And also we can have a constriction at the entrance to the bladder. So 3 potential sites where the ureter can become constricted and then a kidney stone can be lodged. 3 sites: the junction of the ureter and the renal pelvis, the pelvic brim as the ureters cross over it, and the junction at the entrance to the bladder. So let's just now turn our attention to the suprarenal glands and their anatomy. Well, they have a cortex and they have an inner medulla. We can see that each of the suprarenal glands is going to be positioned on the kind of supromedial aspect of the kidneys, and they are surrounded by a substantial amount of perinephric fat and the renal fascia. but they're separated from the kidneys by this fibrous tissue. So there is a separation. The right suprarenal gland is triangular in shape. It's in contact with the IVC medially, and the liver is laterally found. The left suprarenal gland is more semilunar in shape. It's related to the stomach, spleen, and the pancreas. Two parts of the suprarenal glands, and they have different embryological origins. The outer cortex releases corticosteroids and androgens. This essentially causes the kidneys to retain salt and water. That's going to have the effect of increasing the blood pressure. The inner medulla is actually derived from the sympathetic nervous system. It was part of the sympathetic nervous system as it was developed, and it releases adrenaline, which supports that fight or flight response. So the inner medulla of the suprarenal gland is really an extension of the sympathetic nervous system. So it's involved in the fight and flight response. The vasculature of the suprarenal glands is complex, and essentially there are about 3 arteries that supply each of the suprarenal glands. It's a highly vascular organ because it's endocrine in function, releasing hormones into the bloodstream. And in total, there's about 50 or 60 tiny branches coming from these 3 sources. We have, if here's our suprarenal gland, we can see here on the supramedial aspect of the kidney, and here we can see the aorta. We have 3 suprarenal arteries, a superior, a middle, and an inferior. The superior suprarenal artery comes from what's known as the inferior phrenic artery. The inferior phrenic artery is a paired artery, a left and a right one of those paired visceral branches giving rise to the superior suprarenal arteries, that goes to supply part of the diaphragm and the body wall. Along its path, it gives rise to these superior suprarenal arteries that come down and supply the suprarenal gland. We also have middle suprarenal arteries, and these can come directly from the aorta. So middle suprarenal arteries coming directly from the aorta. Sometimes, because the celiac trunk would be located around here, these arteries can also come from the celiac trunk, but the middle suprarenal arteries. And then we have the renal artery, which we know about going towards the kidneys. Along its course, it can give rise to the inferior suprarenal artery, and that ascends up towards the suprarenal glands. So it has these 3 main sources, superior, middle, and inferior suprarenal arteries. And together, these will give a whole series of smaller branches totaling 50 to 60 arteries, indicating its function as an endocrine gland. Venous drainage is a lot more straightforward, and it's by the way of large suprarenal veins, and these can drain into the IVC directly or via the renal vein. So we can see the suprarenal veins draining either into the renal vein here, which will go into the IVC and then up, or it can drain into the inferior vena cava itself. So we can see the vasculature of the suprarenal glands is really complex. So in conclusion, we've looked at the position of the kidneys and suprarenal glands within the abdominal cavity and their relations to other organs, their extensive relations to other organs. We've looked at the 5 segments of the kidney and their blood supply via these functional end arteries, and we've looked at the internal structure of both the kidney and the suprarenal gland. We then looked at the formation of the renal pelvis and constriction along the course of the ureters, and then looked at the arterial supply and venous drainage of the suprarenal glands.